Hi there, my name is Winnie and I'm a pelvic floor physiotherapist and owner of Papaya Clinic in Sydney's Inner West. Today, in partnership with Confidence Club, I'm going to be showing you some pelvic floor exercises that are appropriate for pregnancy and postpartum to help prevent and manage bladder leakage. Now, research shows that pelvic floor muscle training is effective in reducing the onset of stress urinary incontinence if you are asymptomatic. But once symptoms start, the treatment process can be more complicated. This is the reason why we advise all expectant mothers to start a structured pelvic floor muscle training program during pregnancy to prevent the onset of incontinence and continue until at least 6 months postpartum, regardless of whether you have symptoms or not. Regardless of whether you had a C-section or vaginal delivery, there is still substantial loading on the ligaments and tissue of the pelvic floor at the 9 months of baby carrying, and the softening of the connective tissue due to hormonal influence. If you had a vaginal delivery, your muscle layer is stretched 15 times its normal length during delivery. This stretch of the tissue can result in pelvic organ prolapse, where your connective tissue has lengthened and your pelvic organs are sitting lower. One of the symptoms of prolapse is urinary incontinence. Other factors that will help with leaking include weight management, returning to exercises, and having good bladder and bowel habits, such as drinking at least 1.5 to 2 liters water per day and not straining during bowel movement. If you're pregnant or postpartum watching this video and you're already experiencing bladder leakage, you must seek professional assistance from your doctor and a pelvic floor physiotherapist, as you may need other interventions alongside pelvic floor exercises to help treat it effectively. Now let's look at some exercises to help prevent bladder leakage during pregnancy and postpartum periods. Again, everyone's pelvic floor is different, so it's recommended to see a women's health physiotherapist to get a tailored exercise plan for your pelvic floor. So now we start with contract and relax. During pregnancy, it's really important for you to not only learn how to contract, but fully relax as well. This will assist your delivery, especially if you're having a vaginal delivery. Baby's head normally comes through the superficial pelvic floor layer. Babies will stretch your pelvic floor muscles 15 times its normal length. So it is very important for you to learn how to relax when you need to relax, because sometimes what we find is that women contract when they're pushing, and that can really hinder your vaginal delivery. So in order to contract, what you want to think about is, imagine you have a blueberry and your vaginal tissue is softly picking up the blueberry and lifting up to the uterus, so superficial and deep. And then you're going to let the blueberry back down to ground level and open and spill the blueberry out. So that is a full relaxation. So let's go again, full contraction. You're going to pick up the blueberry and lift, and then you're going to relax. So lower the blueberry and then let go. Now remember that you need to be able to breathe throughout the exercises, and that will really help with the vaginal delivery as well. So breathing, try to use belly breathing and not chest breathing. And you want to do deep breathing, deep inhale when you relax, and exhale is when you contract. Now next, we'll do a strengthening protocol. So this is a beginner one to start with. What you can do is 100% contraction, 8 times. Every time you contract, 3 seconds hold, and in between, 6-second rest. You can do this 3 sets a day and 3 times a week. If this is too difficult, you can do fewer repetitions or shorter holds. Now when you're ready to progress, you can increase the difficulty by doing longer holds, changing the position, or doing it with another activity to increase the complexity of the exercise. Now next, we're going to do pelvic floor exercises in 4-point kneeling position. So first, let's get down to your hands and knees. So place your hands underneath your shoulders and your knees underneath your hips. In this position, let's practice some deep breathing to start with. So let's breathe in through your nose, deep inhale, and feel your ribcage expand to the side. Now breathe out through your mouth, deep exhale, and let all the air out. Do that a couple of times. Deep breath in. Good. And deep breath out. Now next, we're going to go into your cat-cow. So you're going to breathe in to prepare. As you breathe out, you're going to pelvic floor contract and then tuck your tailbone under, round your spine, look into your belly button and round your spine, everything comes in. Deep breath in here, And as you breathe out, you're going to stick your bottom out, lengthen your pelvic floor muscles, and then go into an extended position looking up towards the ceiling. Let's do that again. As you breathe out, you're going to tuck your tailbone under, pelvic floor contract, and look into your belly button. As you breathe in, you're going to deep breath in and breathe out to extend and look back up into an extended position. So every single time your pelvis is tucked under, you are contracting your pelvic floor, and every time your pelvis is extended, you are lengthening your pelvic floor. And so for pregnancy, it's really important for you to be able to do both, which is why you want to put an equal emphasis on both the tugging and the extending. Now next, we can also do wagging tails. So let's go back into neutral position to start with. So wagging tails is basically getting your right shoulder towards the right hip. So you're going to tilt your hips over to the right side and then tilt the hips to the left side. With your pelvic floor action, you're going to contract as you tilt towards the right side and then relax back into neutral, contract and tilt to the left side. Back to neutral, relax, contract to the right side. That's it. So every single time your pelvis is right at the center, it is relaxed. And as it goes to the side, it is contracted. Now next, we'll go into bridging. So bridging, let's lie on the ground. That's it. Relax your shoulders and place your feet hip width apart, and your spine is neutral, so there might be a small gap underneath your back. If you're feeling unwell while you're lying down, then this exercise is not appropriate for you. Now, to start with, deep breath in again to prepare. As you breathe out, you're going to contract your pelvic floor, tuck your tailbone under, lengthen through the back of the spine as you roll up all the way to a bridge position. Mindful to keep the ribcage in a little bit and drop the ribcage a little. That's it. Now deep breath in here, exhale to slowly roll back down, upper back, middle back, lower back, all the way until your pelvis relaxes and your pelvic floor relaxes. Now deep breath in again, exhale, pelvic floor contract and lift up. Think about holding the in and up in this position. Breathe in. As you roll down, upper back, middle back, lower back, keep the pelvic floor contracted and then relax at the end. So you can do this for 15 repetitions, 2 sets every day. So next we're going to do sit to stand. So this is a great way to integrate pelvic floor muscle training with functional exercise. So first we find a chair to sit on and make sure that your knees are either hip width apart or wider than hip width apart. Feet are planted in the ground and hands can be on your thighs or your hips to start with. Now, what I want you to do is just deep breath in to prepare, tension your pelvic floor and standing up, driving through the heels, engaging your glute muscles. And then you're going to sit back onto the chair and then relax the pelvic floor. So it's really important for you to engage your pelvic floor, stand up, keep the pelvic floor engaged as you sit down, and then relax at the end. Please do this with a chair against the wall so that you're not going to slip off. Another way is you can also make the exercise harder by choosing a chair that is lower or doing this on an exercise ball, which is really good to prevent pelvic girdle pain as well. Thank you so much for watching. I hope you find these pelvic floor exercises helpful. And remember, for extra guidance and a tailored pelvic floor plan, visit your nearest pelvic floor physiotherapist. Take care, and I'll see you in our next video on advanced pelvic floor exercises.